Hi, everyone, and welcome to the 63rd episode of Battles and Voices. I'm Latika, and I'm the founder and host.
And I'm Camden, and I'm the co-host, and we serve on the executive team of Vitals and Voices.
Battles and Voices brings together people with different experiences in healthcare to share their stories with the world. Please welcome our guest, Dr. Singh.
Hi guys, thanks for having me.
Of course, thank you for coming on. Dr. Singh, thank you so much for being a part of this episode. It means so much to us that you'll be one of our guests today on Battles and Voices. Feel free to kind of introduce yourself and share some things about yourself as well.
Sure. So my name is Sonia Singh. I'm a internal medicine trained primary care physician. I practice in Houston, Texas. I'm originally from California. I moved out here, I guess, 8 years ago. Initially, I kind of worked at a big health system like most PCPs do. And around 5 years ago, I had my son and realized that I wanted something different for my career. And so I started my own direct primary care practice here in Houston. And it's a solo micropractice, so I have no staff. I work on my own. And then a couple years ago, I got so many inquiries about how I did that. I decided to start a second business of helping teach other doctors how to successfully build a micro practice. And then most recently, I've started up another project, which is actually a podcast called The Antisocial Doctors. And I'm doing that with one of my colleagues, Rebecca Behrens, who's also a direct primary care doctor in Houston. And basically, the goal of that is to help unpack some of the things that get discussed on social media that are related to health and wellness and basically do it with more context and nuance. And that, we're not making any money off of that. That's very much a passion project. That's something that we're just passionate about and, want to devote some time and energy to. So yeah, that's me in a nutshell.
Well, I love getting to know that little nutshell about you. And can you tell us a little bit about what inspired you to originally go into healthcare to begin with?
Yeah, so I'm the daughter of Indian immigrants, and I think there's a lot of cultural pressure to go into a very few set of stable careers. So I think there was always like a background pressure of like maybe you should be a doctor. My dad is an interventional cardiologist, and so I grew up around medicine. My mom was a stay-at-home mom for maybe the first 10 years of my life, and then she started doing the business side of his private practice. So it was really like a family affair. And I think a lot of like I got asked a lot in my medical school interviews, like, oh, so your dad's a doctor, like, did that influence your decision? And to be honest with you, like he himself never really pressured me. I think he felt very much that medicine is more of a calling and you should really feel drawn to it to do it and you shouldn't just do it because. And so I didn't feel pressure from him, but if anything, he did influence me in that he loves medicine. He's like a very unique generation. I like medicine is his life, like it is his passion. And I think anytime you're around somebody who loves something that much and is so passionate about it, it's hard not to feel influenced by that. And I make this joke that like in college, one of my roommates was like on the college like a D1 basketball player, and she would talk about her love of the game. And sometimes I'd be like, yeah, I want to play basketball. And I'm like 5'3", not coordinated and like not a basketball player, but when you're around that kind of energy, it's like hard not to be influenced. But when I got to college, I kind of thought, I got really interested in public health and health policy, and I kind of thought I was going to do that. And it was not until I did this advocacy program in Mexico that I went to more for the public health part of it, but that I felt I had this moment of being like, oh no, the clinical part of this seems more fun than like writing policy briefs and being in an office building all day and seeing the same five people at work. So that's kind of where I made the pivot is like late in college.
Definitely relate with you as well. So, what was it like growing up with a family so involved in medicine already?
Um, I guess like it was just it always felt like a familiar world in a lot of ways. Like my my mom would take me to the office, like, when I was on vacations or summer break or whatever, she would be like, come to the office and file these charts, or like, I don't even remember what she made me do now, but something on like a very old school, like desktop with like DOS, like where you had to like type in names and like check for these authorization numbers. Like, I don't even remember the things she was making me do, but just like the world of medicine always felt like familiar. A lot of my parents' friends were doctors. My dad would watch like he started doing interventions in the early days of intervention, so he would like watch videos of people doing angioplasties and like I just remember like that was very normal to like be in the house and he's just like watching some very graphic videos. He would like always dictate at home, so just like the language of medicine felt really familiar to me. So yeah, I don't know, it was just familiar, but I guess like one of the main things I took from it was like, oh, it's really hard and it's a lot of work. Because like my dad worked insane hours for most of my life. And um, once my mom kind of got involved in his practice, like they were constantly talking shop at home, like talking about the practice, talking about who they were hiring or firing or like what drama was going on in the office. And what I took from that was like, oh, private practice seems really hard. Like, I'm never gonna do that. Like, if I'm a doctor, like, I'm not gonna have a wife that's gonna like take care of all the business. Like, I'm gonna probably just try to work for, like, be employed, take home a paycheck, just do the medicine, like, not try to do all this other business that they're trying to do. Which is funny because now I like have a solo business. I do that. But yeah, that's probably, some of the things I learned from being the daughter of a doctor.
I can relate, but like on a like different degree. My mom's currently a nurse, and like I've seen how ever since I was younger, she would always like work like all the time as a nurse. So, but she never pressured me to go into medicine either. But she would always be like, "Come look at these like scans, like come see this, come see that," and just like a little bit of like similarity there, but not on the same level. But I can relate to that a bit too. Um, could you tell us a little bit about the patient advocacy program that you spoke on earlier that you were a part of in Mexico?
Yeah, so it was actually a program that went year round. Like you could be part of this patient advocacy program as just an undergrad, and they had this optional component of like you can go to Mexico for the summer. And I mean, to me, what the patient advocacy program was about was, um, it was focusing on kind of a lot of the aspects of medicine that I think get left behind if you're just looking at like a purely biophysical biological model. One of the things they emphasize in that program is like health and wellness is biopsychosocial, and there's all these social determinants of how healthy or well you're going to be. And there's ways that we can advocate for our patients and their health and wellness that are not just clinical. And so looking at, public health interventions and how we can, support clinical care in a way that makes a bigger difference on a community is kind of like what it was focused on. And we did this program where we went, so the summer program was in Oaxaca, Mexico, and a small group of us went and we stayed with host families and we took medical Spanish and um, we rotated through a bunch of different healthcare settings. So, like, one was a big public hospital, there were some private clinics, there was like a specialty. I don't know, it wasn't really a hospital, like a specialty center for kids with developmental disabilities. I mean, it was just, there were rural, there were urban, like it kind of rotated us through a lot of different settings. We also learned about like border health. We had lectures on a lot of different topics that kind of related to that area and also like the interplay of Mexico and the US. And so one of the rotations or one of the settings that we shadowed in was this like rural single doctor clinic right outside of Oaxaca. And it was just like one room, one doctor. And I remember she was like very pregnant at the time and she was young. And she just had her typewriter and her little stack of charts of files. And like patients would just wait in line outside and she would call one in and they would sit in a chair and she would ask them about their symptoms and she would like type it up and then she would have them go to the exam table and she would examine them and she had just like the very basic medical tools, stethoscope, blood pressure, blood pressure monitor, um, I think she had like a basic well, anyway, she just had like very, very basic tools. Um, and, at the end of it, she would be like, okay, well, this is what I think we should do. And here's a paper prescription, you go get the medicine. And then she would go on to the next person. And there was something about, like, I had gone to work with my dad multiple times in like the US healthcare system, but and I'd been at his office so many times, but there's something about like the simplicity of just that action, like the intimacy of just like her and a person and like talking to them, doing a very simple exam, coming up with a plan, next person, and like something about that like I just felt really drawn to where I was like I could do this. Like I want to do this. Like this feels to me like I could do this all day and it would be interesting and fun and I would feel useful and purposeful. And so that moment was really when I started to have like a shift of like maybe I do want to go to medical school. And so yeah, that was the program and that's kind of where things turned towards clinical medicine for me.
Well, thank you so much for sharing that. And I love how you were able to kind of talk about the experience and what you were able to learn from it and then, bring it back to your healthcare workplace as well. So, how was your experience adapting to the US healthcare system through the practice of medicine?
Yeah, well, so it's funny because that was the moment that I wrote about in my med school essays, and like that was the moment that like made me want to like go into medicine. And then you go through all your education and training, and I think you have these really high hopes of like the kind of doctor you're going to be and how you're going to practice. And then you get out into the world and start trying to do it, and you just feel like there's barrier after barrier to trying to do things the way you tr were trained to do them and the way you want to do them. And nothing feels like that clinic in Oaxaca. Like a typical primary care clinic in the US is so much more chaotic and is there's so many more people involved. I mean, there's a crowded waiting room. Someone's waiting in line at the front desk. They're arguing over a copay. The person, is upset that they've waited 45 minutes for the doctor. Someone else is upset that their appointment was canceled because they were 15 minutes late. Somebody else thinks their visit was free, but like now they've gotten a charge because they talked about something that was not part of a routine physical, and then like you get taken back by a medical assistant who weighs you and then you're feeling bad and then they take your blood pressure and you're nervous and like it's just like it's a very different, the whole experience is very different. And the doctor's walking in and maybe has like 11 minutes with you and there's so many things that were like required to get done in those 11 minutes. Like I have to like listen to you, validate you, hear your history, do an exam, diagnose you, document all of it, explain it to you, explain the risks and benefits, like plus all these other questions that sometimes we're required to make sure we ask, like, did you get your colonoscopy? Did you get your mammogram? Did you get your flu shot? Wait, let me talk to you about the risks and benefits of getting the flu. Like it just to me, primary care in the modern era feels like a really challenging, almost impossible kind of job. And um, it took me, I think, having a baby and having like this other huge priority that I had to think about to finally say, like, I don't think like I can do this way, because it's easy to keep doing it because you look around and everyone else is also doing it. So I think there's just like this mass, like, oh, like this must be normal, but I really don't think it's normal. And so yeah, after I had my baby, I decided like I'm going to do it a different way. And I learned about this direct primary care model. And what's ironic or not ironic, or I don't know what the right word is, like serendipity is like, it's actually what I do now is like so much like what was happening in that clinic in Oaxaca. Like I have a small office. I work there by myself. I just have the most basic stuff and I see one patient at a time and I spend as much time with them as I want. And it's kind of a low tech one-on-one kind of interaction. And it's like I feel so lucky that I've been able to make that work.
That's incredible that you've been able to keep at it and keep on pursuing it. Um, could you tell us a little bit more about the autonomy and medical practice and why this is so important?
Yeah, definitely. So This is a realization that I don't think I came to until like 5 years ago. I definitely did not have any understanding or appreciation of this, like as an undergrad, as a medical student, and even as like a new attending. Um, I used to think about autonomy and think like if you're following the evidence, ever doing good medicine, would you need autonomy? Like if the answer is to order an MRI, then the answer is to order an MRI. If the answer is to not order an MRI, then the right choice is to not order them. Like the idea of, well, I want the autonomy to decide, like didn't really resonate with me because I was like, well, there's a right answer. Like you just follow the evidence and you decide what is the right choice for the patient. Like why do I need it? I understand the patient needs autonomy in like deciding what they value and what is right for them in their own evaluation of the risks and benefits, but I guess I always felt like I don't understand why the doctor needs autonomy. And what I learned from being out in practice is like when you work in these big corporate healthcare environments and you give up control of everything around the medicine, like all the administrative work, all of the business side of things, all of the scheduling, and like when you give up everything and you just say, no, I'm just going to show up and be the doctor, it ends up infringing on the way you care for patients. And one would hope that those things would all be aligned to support you in taking good care of the patient, but that's just not the reality of the situation. Like a lot of things that are well intended, like insurances now require so many things to get prior authorization. Like you must prove to them that what you are ordering for the patient is justified. And I can understand the reason for that. Like, you don't want doctors just willy-nilly ordering things that patients need and them having to pay for it and the insurance having to pay for it. Like, I can understand why that exists. But in reality, the way it exists is to create hoops for people to jump through and for the company to hope that you don't jump through it and that they don't have to end up paying for it. And it delays care that is absolutely appropriate and justified and necessary. And that's like the world we live in. And, so that's the insurance company piece of it. And then, the kind of corporate healthcare model is that, they are not setting up practices to maximize the quality of care or the patient experience or the doctor experience, certainly. They're setting it up to maximize their profit. So ultimately, they're going to try to squeeze as many patients into the day as possible. And they do that because of the often like free and invisible labor that doctors do at home after clinic shuts down, where they take home their notes and they finish them in the evening when they're in their bed and their kids are asleep. And we've been doing that for many, many years, and it's only getting worse. So, I think to me, what autonomy means is I get to make decisions about how I practice medicine and about all of the things around the medicine, like how long I spend with each patient, how quickly I can get them in, what treatments are appropriate and not appropriate for them. And to have that level of control allows me to practice in a way that I feel proud of. And I think when I don't have autonomy, it feels as though I'm constantly compromising the way I'd like to practice. And it's a terrible feeling to constantly feel like you could be doing a better job or you should be doing a better job or you want to be doing this differently, but you just can't, you know? So yeah, I mean, I don't think I had any understanding of that. I mean, until I was like 35 years old. So if I can impart that on anybody earlier, that's great. So
Well, thank you for sharing that. And I'm so sorry if you like saw my video like going on and off. I don't know what's
oh, that's
happening.
okay.
Yeah, I'm so sorry.
That's okay.
So, do you have any stress relieving techniques or any hobbies that you do when you have a lot to do within your work, or even if you aren't having the very best day as well?
Yeah, I mean a lot of them. So, I would say like taking walks with my dog, even just like from my office building, like taking a walk to the coffee shop in complex just to like get outside and have a moment, is probably one of them. Exercise or any kind of movement is probably one of them. I'm somebody who I think processes a lot of what I feel through writing. And so writing for me has been like a really big part of managing my own stress and just kind of processing the entire experience of being a doctor, which is very like the training and the practice of it is like a very intense experience. And so writing has really helped me do that.
That's great that you're able to like focus on and like relieve your stress through writing. Um, what has been like the biggest piece that you've written? And before we get to the next question, sorry.
Yeah. Well, I've had a few pieces published in like medical journals. The one that probably got the most attention was I published a piece called Morning Report in the New England Journal of Medicine. It was like a perspective essay. And it was basically just it was written in the second person and it was describing like a morning in the life of an internal medicine intern and sort of all the things that are running through your mind and all the challenges and how there's just so many like logistical and intellectual demands of like your time, like your pager constantly going off with this thing, that thing, this thing, that thing, this thing. And um, I mean, the point of the essay was to kind of zero in on like you're going to make so many mistakes, you're going to do things that you know you're gonna fall, you're gonna make mistakes, but like the moments that matter are just like how you show up. And so like the example was like you're going through your pre-rounds and you're trying to see these 15 people before the morning report starts, which is like the meeting that residents have like to go over cases. And um, you see like one of your patients is like starting to cry, and you can rush out of the room or you can like be with the person in that moment. And being with the person in that moment is probably the stuff that you're going to remember and that you're going to feel good about. And not knowing the answer when someone asks you a question on rounds is like not something that it matters and that you're going to take with you. So anyway, that was probably my most successful piece of writing.
Well, that was incredible to hear about. And moving on to the actual question now. How was your experience starting 10 micro practices all over the country in the past 1.5 year?
Yeah, so I started, I mentioned at the top of the episode that I started this like educational platform basically to try to teach other doctors how they can start solo practices. In medical school, we don't learn anything about business or marketing or like how to start a practice. And like less and less doctors have done that over the last couple decades. And so I got a lot of questions about it from other doctors, and I thought, like, okay, let me create a resource that allows me to share this information more efficiently. And it took a lot of, like, I kind of worked on making, so I basically made an e-course, and then I have a podcast that supports that. That's free to anyone. And I worked on it, like the content for the course, mostly over one summer, like right after I had my second baby. And it was so much work. And I did it and then I was kind of like, is anyone going to sign up for this? Like, is anyone going to pay for this thing to like learn how to do this? Like, are they going to trust me? Like, are they going to look at this me and say like, what does this lady know? Like, why should I listen to her? And it was a totally new thing for me. Like, it's totally out, it's a business, it's a consulting and consulting and education business. And that's not something that like I really knew how to do as a doctor. So, um, yeah, it was a very scary endeavor, and it took a little while to really kind of get it going. But now I feel so like it was all so worth it. I mean, to have 10 doctors that I feel like I helped in some way get their lives back and practice in a way that they are excited and happy about. Like I think about the ripple effect of that for not just them, but like their children and their families and the patients that they serve. And that's really exciting to me. So yeah, it feels really good. And even if like tomorrow nobody else ever signs up for the class or like does it, I even if it's just those 10, like I feel like that was worth it. And I'm really proud of that.
Well, that is such a huge accomplishment. So congratulations on, having the time to do all that. It's really amazing. Amazing.
Thank you. Thank you.
So do you have any future goals that you plan on working towards right now?
Um, yeah, I mean, I would say I'm like a creative at heart, so like I never stop coming up with ideas and projects and plans. My husband kind of starts like rolling his eyes when I'm like, I have a new project that I'm working on because I always have a new project. Um, and I think I've gone through phases of like what I'm most passionate about at any given point. Like I think early in my career, I was really passionate about nutrition, food policy, public health. And then I think I got really passionate about sort of um, supporting other doctors and trainees, like dealing with burnout, because I had dealt with burnout. And that's kind of what I talked about in that essay and another couple essays that I've written. So that was kind of like the theme of what I was doing for a while. And then I became very passionate about this idea of autonomy and practice and not, and to kind of taking control over like how we practice medicine as doctors. And I feel like this next wave now is like I'm feeling like social media is it is a very big threat to our wellness and safety. And I think we're only just barely scratching the surface of how it's like the impact that it's going to have on our health and wellness. And I'm really passionate about coming out and being very loudly an advocate for like better digital literacy, better digital hygiene, um, more like amplifying voices of actual expertise in the wellness space, being really loud about the ways in which social media kind of pushes people towards extremes and um, completely ignores like nuance and context. And I think all of that can be incredibly dangerous. And I just don't feel like we're talking about it enough. So that's kind of what has driven Rebecca and I to start this new podcast. And, I think for us, seeing all this stuff around us and talking to like hearing it from our patients, like causes us a certain level of stress. And we talk to each other about it and say, oh my gosh, like I just wish like people would understand X, Y, and Z. And so I think for us, like we're doing this project as like a for other doctors and patients who maybe can use this podcast as a resource. So, like when a patient comes in with a question that they asked based on something they saw on social media, a lot of doctors are not going to have the time we do to explore that topic, research it, come back to the patient, have a full conversation, build trust with them, have a relationship with them. And so, I think our goal is like, okay, this is a resource for them, but also I think it's a way for us to channel our own like strong feelings about it into something productive so that we're not just spiraling and complaining to each other. So um, that's kind of what the project was born out of. And yeah, I hope people will take a listen and give it a chance and share it with people if they think it's useful.
That's incredible. That's incredible to hear. And I know we spoke on this a little bit earlier with your dad, but is there anyone else who, in particular, that has given you this motivation that come this far?
Oh, I mean, I think my kids give me a lot of motivation just because I think I think there's this culture of sort of self-sacrifice in medicine or like martyrdom where you're like, no, just do what's best for the patient. Like doesn't matter if like you're uncomfortable or you're tired or you're using your leisure, your free time, like you just do what's right. And I think I related to that for a very long time, but then when I had my son, I just constantly had to think about like, well, no, if I take these 10 charts home to do at home, like I'm taking that time away from him, and that I think is very motivating for me to start thinking about, well, like how else can I do this and how else can I make it work? Um, and I also think I have a brother-in-law and a sister-in-law who she's a dentist and he's a doctor, but they're both like very independently minded and um they both well, my sister-in-law has her own practice and my brother-in-law has just done a lot, he has a lot of different projects going on. So I would, I came to him for advice at one point saying like, well, how can I negotiate with my job? And like, what should I ask for? Like, how much money should I ask for? Like, what role should I ask for? Like, I'm unhappy and I need to figure out a way to like make this more sustainable for me. And he was just he was, basically what he said was like, you can ask for as much as you want. And if they say no, like you just go and you make that money yourself. Like you just build whatever you want to, whatever clinic you want to work in, like you go out and build it. And he had kind of said things like that to me in the past, but for some reason, like in that moment, I was like ready to receive that. And I was like, yeah, I should just do that. Like, I don't know why I'm allowing all these other people to like dictate what my time is worth or how much a patient, how much time a patient should get with me. And so I just, something about like the way he said it to me at that time, I was like, yeah, you're right. Like I should get to decide this, and if I want to do it a different way, like I should try that. And maybe it works, maybe it doesn't, but we're very fortunate as doctors to have a lot of job security. So I kind of knew that, if it doesn't work out, like I can go back to traditional practice and it'll be okay.
Definitely. And lastly, to wrap things up, do you have any advice to give to any of the members in the audience hoping to reach this particular stage in the future?
Oh, I mean, I guess I would just say that. I mean, tell me who most of the listeners are. Like, what stage of life do you think most of the listeners are in? Because I don't know the answer. I guess it
Um,
would vary depending on like where they were.
Anywhere from, I guess, early teens to all the way like 30s, I guess, just
Well, okay, what I would say is medicine is a really demanding but also really fulfilling career. I think if it's something you're passionate and excited about, it's like a wonderful, I mean, I feel like it's a privilege to get to do what I do. Um, I think if you're in medical training and it's hard and you're burned out and you're tired and you're second guessing yourself, I would say to that person, um, like it gets better. There are so many different ways you can practice when you get out. And I think um, we're in a really exciting time in medicine where I think there's opportunity to do things that are outside of the box and to practice in a different way. And so I would just say, like, keep your mind open to kind of unconventional routes. And then lastly, I would say, I don't think whatever you choose has to be forever. I think different things are right for different seasons of your life. The same job that maybe was right when you first graduated may not be right for you like 5 or 10 years later. And it's like it's very much okay to pivot and try something different.
That is some incredible advice, and thank you so much for sharing your journey to healthcare along with all the things that you are passionate about.
it was truly inspiring to hear about how you grew into your love for medicine over the years.
Oh, well, thank you so much. And thank you guys for having me.
Of course, and to everyone tuning in, thank you so much for joining us on today's episode of Vitals and Voices. Your engagement and loyalty means the world to us.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes on Vitals and Voices.
We'll see you next time.